crucial concept you'll need to master cell injury. So, grab your notepads and let's break it down. First, what is cell injury? Simply put, it's any change that impairs the normal function of a cell. Cell injury can be reversible or irreversible. Reversible injury means the cell can recover once the stress is removed. Irreversible injury, on the other hand, leads to cell death. Now, let's talk about the causes. Cell injury can be caused by a variety of factors. Physical agents like trauma, extreme temperatures, and radiation. Chemical agents, including drugs, poisons, and alcohol. Biological agents like bacteria, viruses, and parasites. And don't forget about nutritional imbalances, genetic defects, and oxygen deprivation. Speaking of oxygen deprivation, hypoxia is one of the most common causes of cell injury. Cells need oxygen to produce ATP through oxidative phosphorylation. Without ATP, cellular functions start to fail. Hypoxia can result from ischemia, anemia, or carbon monoxide poisoning. Let's move on to the mechanisms of cell injury. There are four main pathways: ATP depletion, mitochondrial damage, influx of calcium, and free radical formation. ATP depletion affects energy-dependent processes. Mitochondrial damage leads to loss of membrane potential and release of pro-apoptotic proteins. Influx of calcium activates enzymes that can degrade cellular components, and free radicals cause oxidative stress, damaging proteins, lipids, and DNA. One key concept you need to understand is apoptosis versus necrosis. Apoptosis is programmed cell death, a controlled and necessary process for removing damaged cells. Necrosis, on the other hand, is uncontrolled and results in cell life, which often triggers inflammation. In summary, understanding cell injury is essential for diagnosing and treating various diseases. Recognizing the causes and outcomes of cell injury will help you become better clinicians. So keep studying and stay curious. That's it for today's breakdown of cell injury. Thanks for tuning in. In this chapter, we're going to explore reversible injury, where cells can bounce back if the damaging stimulus is removed. It's like giving your cells a second chance at life. First, let's revisit one of the causes of cell injury we discussed earlier. Hypoxia, or oxygen deprivation, can lead to reversible injury if the oxygen supply is restored quickly. For instance, if blood flow is temporarily restricted but then restored, the affected cells can recover. Next, consider chemical agents. Low doses of certain chemicals or drugs can cause reversible injury. Mild alcohol intoxication may impair liver function temporarily, but with time and abstinence, the liver cells can repair themselves. Physical agents like mild trauma or low-level radiation can also lead to reversible injury. Think of a minor bruise or a mild sunburn. Additionally, cells can initiate autophagy, a process where they digest and recycle damaged components. It's also essential to mention that the cell membrane plays a crucial role in reversible injury. Maintaining membrane integrity allows cells to control their internal environment, preventing further damage. If the membrane remains intact, cells have a better chance of recovering from stress. In summary, reversible injury highlights the resilience of our cells. How cells can recover from mild stress is crucial for developing treatments that support this natural healing process. Keep this in mind as you continue your medical journey. That's it for our discussion. Until next time, keep pushing the boundaries of your knowledge. Welcome back, future doctors. In this chapter, we will explore irreversible injury, where cells cannot recover and undergo cell death. Unlike reversible injury, irreversible injury signifies the point of no return for the affected cells. Let's start by revisiting hypoxia. Severe or prolonged oxygen deprivation can lead to cell death, as the cells are unable to generate functions. For example, a heart attack can cause irreversible damage to heart muscle cells if blood flow is not restored quickly. Prolonged or high-dose exposure to toxic chemicals or drugs can overwhelm cellular repair mechanisms, leading to irreversible injury. Alcohol abuse can result in permanent liver damage, known as cirrhosis. Severe physical damage, such as extensive trauma or high-level radiation, can also cause irreversible injury. Think of a severe burn or a radiation blast. The affected cells are so extensively damaged that they cannot repair themselves and ultimately die. Now, let's delve into the cellular mechanisms behind irreversible injury. When cells experience severe stress, they may undergo necrosis or apoptosis. Necrosis is a chaotic and uncontrolled form of cell death, often resulting from acute injury. It leads to cell swelling, membrane rupture, and inflammation. Apoptosis, on the other hand, is a programmed and orderly process. It's like a self-destruct mechanism that helps eliminate damaged or unneeded cells without causing inflammation. One key factor in irreversible injury is the loss of. When the cell membrane is severely damaged, it can no longer regulate the internal environment, leading to cell death. Additionally, damage to critical cellular components such as mitochondria and DNA can trigger irreversible injury. In summary, irreversible injury marks the end of the road for affected cells. Understanding the causes and mechanisms of cell death is crucial for developing strategies to prevent and treat severe injuries and diseases. As you continue your medical journey, remember the importance of early intervention to prevent irreversible death. That's it for our discussion on irreversible injury. In this chapter, we will delve deeper into two critical causes of cell injury: hypoxia and ischemia. Conditions are often interlinked and have significant implications for cellular health and function. First, let's understand hypoxia. Hypoxia refers to a deficiency of oxygen in the tissues. It can occur due to various reasons, such as high altitudes, respiratory diseases, or anemia. When cells are deprived of oxygen, struggle to produce the needed for the cannot receive the oxygen and nutrients they need, leading to cellular dysfunction and injury. The relationship between hypoxia and ischemia is critical to understand. While hypoxia can occur independently, ischemia always results in hypoxia. For example, during a heart attack, a blocked coronary artery causes ischemia in the heart muscle, leading to hypoxia and subsequent cell injury. One of the key mechanisms through which hypoxia and ischemia cause cell injury is through the disruption of cellular metabolism. Cells rely on oxygen for aerobic respiration, a process that generates ATP and leads to accumulation of metabolic waste products, which can further exacerbate cellular injury. The lack of blood flow also means that cells cannot receive essential nutrients, leading to further stress and potential cell death, and their mechanisms is crucial for developing effective treatments. In this chapter, we will explore the fascinating yet perilous world of chemical agents and their impact on cellular health. Chemical agents, ranging from environmental toxins to pharmaceutical drugs, can have profound effects on cells, leading to injury and dysfunction. First, let's categorize the poisonous agents are produced within the body, such as metabolic byproducts or reactive oxygen species, causing increased permeability and loss of cellular integrity. This can lead to the leakage of essential ions and molecules, ultimately resulting in cell death. Another critical mechanism is the generation of free radicals are highly reactive molecules that can cause oxidative damage to cellular components, including lipids, proteins, and DNA. Excessive alcohol consumption can lead to the production of acetaldehyde, a toxic metabolite that generates free radicals and damages liver cells. Chemical agents can exclude cytochrome C oxidase, an enzyme in the electron transport chain, effectively halting cellular respiration, determining their toxicity. A small amount of a toxin might be harmless, while prolonged or high chemical agents that can cause cell injury, their mechanisms of action, and the ways to mitigate their effects. In this chapter, we will delve into the world of physical agents and their impact on cellular health. Physical agents, including trauma, temperature extremes, and radiation, can cause significant cell injury and even cell death. Let's begin with trauma. Physical trauma, such as cuts, bruises, and fractures, can directly damage cells and tissues. The mechanical force disrupts cell membranes, leading to immediate cell death in the affected area. Additionally, trauma can cause secondary injury through inflammation and the release of harmful enzymes from damaged cells. An abnormally low body temperature can cause severe cell injury. In hyperthermia, proteins denature and enzymes lose their function. Ionizing radiation, such as X-rays and gamma rays, can break chemical bonds and generate free radicals, leading to DNA damage and mutations. This can result in cell death or, in some cases, cancerous transplant and increasing the risk of skin cancer. Understanding the mechanisms by which physical agents cause cell injury is essential for diagnosing and treating patients who experience these types of injuries. For instance, prompt and appropriate treatment of trauma can minimize secondary damage, while protective measures against extreme temperatures and radiation can prevent cell injury altogether. As future medical professionals, you'll need to be aware of the various physical agents that can cause cell injury, their mechanisms of action, and the ways to mitigate their effects. This knowledge is vital for providing comprehensive care to your patients. Thank you for joining us. Stay tuned for more in-depth discussions on cell injury, and in this chapter, we will explore how infectious agents like bacteria, viruses, and fungi cause injury, and the body's injury through several mechanisms. Some bacteria produce toxins such as exotoxins and endotoxins, which can disrupt cellular functions and lead to cell death. For instance, the exotoxin produced by Clostridium, the causative agent of tetanus, interferes with neurotransmitter release, leading to muscle spasms and cell damage. Additionally, certain bacteria can invade and replicate within host cells, causing direct cell injury. Next, we have viruses cause cell injury by hijacking the host cell's machinery to particles. The influenza virus infects respiratory epithelial cells, leading to cell death and respiratory symptoms. Some viruses, like the human immunodeficiency HIV, can integrate their genetic material into the host genome, causing long-term cellular dysfunction and immune system impairment. Fungi, though less commonly discussed, can also cause significant cell injury. Fungal infections, or mycoses, can range from superficial skin infections to systemic infections affecting multiple organs. For instance, Candida albicans can cause thrush and systemic candidiasis, leading to cell damage through the production of enzymes that degrade host tissues and the formation of biofilms that protect the fungi from the immune response. The body's response to these infectious agents involves the immune system. When an infection occurs, the immune system activates various defense mechanisms to eliminate the pathogens. This includes the release of inflammatory mediators, recruitment of immune cells, and production of antibodies. As future medical professionals, you'll need to be aware of the various pathogens that can cause cell injury and the ways to support the body's defense mechanisms while minimizing collateral injury and recovery. In this chapter, we will discuss how the body's immune response can sometimes cause cell injury, including hypersensitivity reactions and autoimmune diseases. First, let's delve into hypersensitivity reactions. These are exaggerated immune responses that can cause tissue damage and cell injury. There are 4 types of hypersensitivity reactions, classified as type 1 to type 5. Type 1 hypersensitivity, also known as immediate hypersensitivity, involves the release of histamine and other mediators from mast cells and basal This can lead to conditions such as allergic rhinitis, asthma, and anaphylaxis. For instance, in an allergic reaction to pollen, the immune system mistakenly identifies pollen as a harmful agent, leading to inflammation and cell injury in the respiratory tract. Type 2 hypersensitivity or cytotoxic hypersensitivity. Antibodies target cells, leading to their destruction. An example of this is autoimmune hemolytic anemia, where antibodies target red blood cells, causing their lysis and leading to anemia. Type 3 hypersensitivity or immune complex mediated hypersensitivity involves the formation of antigen-antibody complexes that deposit in tissue. Type 3 hypersensitivity. Type 4 hypersensitivity, also known as delayed type hypersensitivity, is mediated by T cells rather than antibodies. This type of reaction causes cell injury through the release of cytokines that attract and activate macrophages. Contact dermatitis, such as the reaction to poison ivy, is a classic example of type 4 hypersensitivity. Next, let's explore autoimmune diseases, where the immune system mistakenly attacks the body's own cells and tissues. Autoimmune diseases can affect various organs and systems, leading to chronic inflammation. For example, in rheumatoid arthritis, the immune system targets the synovial membrane in joints, causing inflammation, pain, and joint damage. In type 1 diabetes, the immune system attacks and destroys insulin-producing beta cells in the pancreas, leading to insulin deficiency and hypertension. The mechanisms underlying autoimmune diseases are complex and involve genetic, environmental, and immunological factors. While the exact causes are not fully understood, it is known that dysregulation of the immune system plays a key role in the development of these conditions. Understanding how immunologic reactions can cause cell injury is crucial for diagnosing and managing these conditions effectively. As future medical professionals, you'll need to be aware of the various types of hypersensitivity reactions and autoimmune diseases, their mechanisms of action, and the strategies to modulate the immune response to minimize cell injury and improve patient outcomes. Thank you for joining us in this chapter. In this final chapter, we will look at how nutritional imbalances, such as deficiencies and excesses, can lead to cell injury. Let's start with nutritional deficiencies. When the body doesn't receive essential nutrients in adequate amounts, it can lead to various forms of cell injury and systemic issues. For example, a deficiency in vitamin C can result in scurvy, characterized by weakened connective tissues, bleeding gums, and delayed wound healing. Vitamin D deficiency can lead to rickets in children, causing weak and deformed, or osteomalacia in adults, leading to bone pain and muscle weakness. Iron deficiency is another common issue, leading to anemia, characterized by fatigue, weakness, and impaired cognitive function due to reduced oxygen carrying capacity of the blood. On the other hand, nutritional excesses can also cause significant cell injury. Excessive intake of saturated fats and cholesterol can lead to atherosclerosis, where fatty deposits build up in the arterial walls, leading to reduced blood flow and increased risk of overconsumption of sugar, can lead to resistance and damage to various organs, including the heart, kidneys, and nerves. Micronutrient imbalances can also have profound effects on cellular function. Excessive intake of vitamin A can lead to toxicity, causing symptoms such as nausea, headaches, and even liver damage. Similarly, an excess of sodium can lead to hypertension, increasing the risk of cardiovascular diseases and causing damage to blood vessels over time. It's essential to understand the delicate balance required for optimal nutrition. Both deficiencies and excesses can disrupt cellular homeostasis, leading to various forms of cell injury and disease. As future medical professionals, you'll need to educate patients on the importance of a balanced diet, and the potential effect of nutrition on cellular function will enable you to provide better care and guidance to your patients. Thank you for joining us in this educational journey on cell injury and recovery. Don't forget to like, share, and subscribe for more insightful content. Until next time, keep exploring and expanding your medical knowledge.